Finally, operating framework, and again a challenge there, partly coming from some of the poor results coming from the CQC and other places on elderly care. That's the reason why we succeeded in getting something in the operating framework this time round. But a challenge there to not just rely on the national patient surveys, but to use local methods, whatever they are, and many good areas of practice there, to really get people's heads around the experience of patients and publish it and to act on the results. So, looking at the research, this won't be new, I'm sure, but we know a lot about what's important to patients. And this is a slide summarising some research coming out of the NHS Next Stage Review, the DARSI agendas, I'm sure many of you remember. So some key headlines there that won't be a surprise. So getting the basics right, treating me as a person, not a symptom, working with me as a partner, and fitting in with my life. And that's very simple statements, but lots of challenges in there to get that to work smoothly. Just unpicking some of those issues a bit more, and we know that some of those are transactional things. It's waiting times, it's whether the toilets were clean, it's whether the food was warm enough or to your to meet your cultural needs, for example. And they're a little bit easier to measure perhaps than some of the more subtle relational and emotional issues, which are just as important to patients and sometimes more so. And I think sometimes there's a need to look to make sure that we get the balance right between those transactional things and the relational things. So, for example, I'll talk a bit more about shared decision making later, to just reinforce how important that relational aspect is. We've commissioned some research a couple of years ago to really look hard at what matters to patients and try and explain what we should do further on patient experience to make sure we deliver the experience that patients want. That research was conducted by the NHS Institute and King's Fund and King's College London, and together they came up with a clear recommendation to us that there's plenty of research on what matters to patients, and it's summarised very neatly in one of several frameworks, and this is one of them, which I'm sure you've seen before, but this was devised by the Picker Institute, and it gives a kind of handy summary or checklist of the things that are important to patients. And I think if we can draw on this, of course there will be sort of variations on a theme within each of these categories, and some things will become more or less important as time goes on. But I think this is a really handy framework that can help us refocus on the kinds of things that we're asking and the kinds of things we're looking at in services. So that research is going to be published very soon. There's a lot more to it than just the framework issues. There's all sorts of useful recommendations, and there's some linked guidance being drawn together by the NHS Institute, and Alison Kirk will talk about that a little bit later on. So how to track patient experience? Well, apparently you've seen this slide before, so sorry about that, but I think it bears repetition, because we need, between all of us, to make sure we track patient experience in a number of different ways for different purposes. And of course at the national end we focus on the quantitative, the comparable, the robust, so that it's fit for purpose for outcomes framework and for performance management, and to allow patient choice at a national level. At a local level, it's a very different story, and that's absolutely right. So patient stories, patient comment being used locally, all sorts of kiosks and real-time feedback being used. So many mechanisms there, and no one is correct to the exclusion of others. And this is something we keep reinforcing to our colleagues nationally who think who want everything out of one mechanism. So, and looking at the national stuff, really, we've got the National Patient Survey Programme, which is great in many respects, but it has a number of drawbacks. It doesn't meet all of the needs. Many people say it's quite slow. Well, if it's postal, if it's robust, it's going to be a bit slow. It's never going to be real time. But also, is it, I think we need to look again at whether it's focusing on the right organisations. Is it quite acute focused? Is it looking at community services effectively? How can we look at specific clinical conditions? How are we looking at pathways of care? And we've got some research just about to be commissioned on some of those aspects as to how we can look at pathways and how we can get more granular levels out of the existing survey programme without compromising its robustness. So just a word about patient comment and ratings. Obviously social media is the thing at the moment, and I guess that's can be quite challenging for providers to be able to use those networks and those types of media in a way that's helpful and that doesn't consume massive amounts of time, but still makes good use of the comment. So there are a number of suppliers who I'm sure you're familiar with, and depending on which one you pick, patients can rate or comment on all sorts of different types of providers, both adding in free text comments, but also providing an overall rating or asking specific questions. So that's great if there's enough comments or ratings for patients to make choices, but often it's the volume isn't quite big enough for any one provider, particularly at the GP or dentist level. There's not enough comments to really give a patient a particularly good feel. Compared with hotels, for example, which is obviously very different, but the volumes are still quite low. So I think it would be good to boost that, but obviously there's more work needed within local providers to make use of those and work out a way of responding to patients that's going to be helpful to everybody. Just to mention the ways of analysing comment, there are a couple of experiments going on at the moment between, well, various, depending on who the providers are, but a number of ways of analysing that comment using, for example, sentiment analysis. So there's ways of picking out the words and then trying to make sense of them and analyse in a quantitative way. Now that's quite hard and needs to be done in a way that doesn't give you misleading results, but I think there's some quite promising thinking there. So looking at where we need to be locally and nationally, and I've said a little bit about this already, I think what we want to do is make sure the national surveys are as lean and as frequent as they can be, look more at how we can make them granular, look more at the pathways issue, but also complement the local work, which is much more fast, reactive, able to drill down into specific areas of concern or of good quality, and look at really local services and even down to ward level. And of course, as we said earlier, there's many different approaches for doing that.